Most recently, due to the COVID-19 pandemic, we have heard a lot of talk of this organization. But who really is the Center for Disease Control and Prevention, also known as the CDC? And what is their role? Joseph Fontaine founded the CDC on July 1st of 1946 in a small building in Atlanta, Georgia. At the time, its main purpose was to prevent the spread of malaria, which was running rampant through the American South. Fontaine was an advocate for public health issues and had a vision to extend the CDC's responsibility to assist with other communicable diseases. In 1947, the CDC purchased 15 acres of land in Atlanta to create what is now the CDC headquarters. In 1948, the U.S. became malaria-free, and the CDC was established for communicable diseases. Its 5 branches include epidemiology, training, technology, laboratory, and administrative. Currently, the CDC is a major component of the United States Department of Health Services, which focuses on health promotion, prevention, and preparedness. The mission of the CDC is to protect the American public's health, safety, and security from both foreign and national threats. The CDC is invested in fighting diseases and supporting communities throughout the United States as a whole. In order to protect the nation's health, the CDC conducts scientific research, provides health information, and responds to health issues when they arise. The CDC has 6 major roles that drive the organization. 1. Detecting and responding to new and emerging health threats. 2. Tackling the biggest health problems causing death and disability for Americans. 3. Putting science and advanced technology into action to prevent diseases. 4. Promoting health and safety behaviors for communities and environments. 5. Developing leaders and training the public health workforce, including disease detectives. And lastly, taking the health pulse for the nation. The CDC cited that in the 21st century they are committed to using cutting-edge technology to confront global health crises, providing knowledge and education to individuals and community health care programs, and by nurturing awareness of public health. While the CDC has a primary role of protecting the health of Americans residing in the United States, they also serve an important active role in the health of the global community. This makes the CDC have a large presence all over the world. Presently, the CDC's Emergency Operations Center is the world's leading disease surveillance program. Since its establishment in 2001, the EOC has responded to more than 60 public health issues such as Ebola, Zika, and anthrax. With 10 global disease detection centers in Oversea Lab, the Global Rapid Response Team has pioneered cutting-edge research and diagnostic tools for diseases such as HIV and AIDS and Zika. Since its inception in the 1940s, the CDC has been actively involved with the creation or administration of multiple healthcare programs and research initiatives. Many of these existing programs were transferred over from other departments to the CDC. Some of these programs include the Immunization Assistant Grant Program, the Foreign Quarantine Service, the Smallpox Eradication Program, the Office of Biosafety, and the Dental Disease Prevention Activity. The CDC has also worked extensively with diseases in the United States and around the world, such as rabies, polio, measles, swine flu, tuberculosis, E. coli, Lyme disease, and sexually transmitted diseases, just to name a few. Aside from the serious and sometimes gloomy aspects that the CDC plays, some interesting facts about the CDC is in the 1960s, they were tasked by NASA to ensure that no germs from Earth would get transported into space. Another interesting fact is the CDC currently has a zombie preparedness program that started as a campaign joke in order to bring in a new audience, but quickly grew into something more with blogs, classrooms, and other educational tools. Overall, the role of the CDC is to make sure that Americans and the world is informed, educated, and prepared for disease and illness that might threaten humanity. Funded by the United States government, the CDC's epidemiologists, scientists, and administrators strive to keep communities in the United States healthy through public health initiatives. The CDC's role is to support state and local health departments by providing educational resources.